Welcome to Medication Monday.
Hello.
Hello. I'd like to talk about Zofran today.
Zofran. Okay. Tell
Hmm.
me, what do you want to know about Zofran?
So what is it? Why would I take it?
Zofran is indicated for nausea. It's a type of medication that works on certain type of neurotransmitters in your brainstem. And when folks have nausea from some illness or something, uh, you can taper down or you can block that signaling to your brain by using Zofran. It comes in like a meltable pill, so you can put it on your mouth and it just kind of dissolves and you swallow it, which is nice because when you're feeling sick, you don't want to have to take a pill and might vomit it back up, of course. We use Zofran here while we're administering another medication called ketamine, because ketamine can sometimes make people feel nauseated. So Zofran is a good medication agent to treat the nausea, to allow the patient to have ketamine. And then on top of that, in hospitals, Zofran's used often to treat nausea in and around surgical procedures or anesthesia. So imagine you get anesthesia and you have a procedure and you come out of anesthesia and you're nauseated. What they'll sometimes do is the anesthesiologist will give you intravenous Zofran to prevent you from having post-operative nausea. So that's its main function.
Okay. So if I take the dissolvable tablet, how long does it take to work?
I think the Zofran kicks in pretty quickly, within 15 minutes I've seen. It's mainly prescribed by anesthesiologists, probably primary care doctors, and gastrointestinal doctors who deal with disorders of your gastrointestinal system, or who are performing procedures where medicines can cause you to feel nauseated. But it's one of those medications that one would need to talk to their doctor about, because there can be interactions with Zofran and other medications. And so you just want to be careful.
Okay. So women with they're pregnant and they have morning nausea, is Zofran ever prescribed?
I can't answer that one because I'm not an expert in OB-GYN. And yet I do prescribe other medications to pregnant women, like antidepressants and things like that. And as doctors, we're really careful when prescribing medicine in a pregnant woman, because the baby is developing in the first trimester and developing all their organs. And then after the first trimester, which is 12 weeks, you have a second trimester and then the third trimester. And so the baby can be exposed to medication through any of those periods. But we're really careful about the first trimester, when the baby's organs are developing, and their face is developing and all that. And then we are mindful at the third trimester, because if a mother is on a medication and is about to have a baby, that medication could induce labor. It could cause the baby to have some kind of distress after the mother gave birth. And also breastfeeding, we have to be careful that the medications that mothers are ingesting, that they're taking, isn't being carried through the breast into the baby. And that's a whole nother discussion, which is very detailed. But for Zofran, I can't answer that. I would have to defer to the OB-GYN doctors.
Okay. Fair enough.
All right.
Last question.
Mm-hmm.
So is this going to make me sleepy?
Zofran, yeah, sometimes I've had patients are sleepy on it, but not typically. I think it's pretty well tolerated. But it can be a side effect.
Okay.
And remember, any medication can cause a whole host of side effects in a patient. A lot of times patients will say, hey, my friend takes X, Y, and Z drug, and I want to try that. But I'll know that medication might cause side effects in my patient. So the way I know that is from my history taking like what past medications has the patient taken, how do they respond to that, and there's a lot of confusion of like what class the medication is in, how does it work in the brain, all these different things. So I'm just real careful when prescribing. Anyways.
Okay. Well, thank you.
Very welcome.
That's
See you
all I
next
got.
time.
See
All
you
right,
next
bye-bye.
time.